Hello and welcome to another video in Foundations in Maternal and Newborn Health. In today's video, we're going to be talking about errors in development. Errors in development. So this is by no means comprehensive. We aren't talking about all the possible developmental errors, but just some of the issues that can happen during pregnancy that would be outside of the scope of midwifery, but would be interesting to know about what can go wrong from a product of conception. So the first one that we'll talk about, that we've actually talked about before briefly, is a molar pregnancy. Molar pregnancy. So again, this is a product of conception, but something goes wrong. And so over here we'd have an example of kind of a normal implantation. The egg and the sperm fertilize to form an embryo that attaches to the wall of the uterus and starts growing normally. And over here we have an example of a molar pregnancy, and it grows very rapidly. It's almost like cancer. And so this is actually an aneuploidy. Usually anyways. And we've talked about aneuploidy in the genetics section, but I'll just mention it again here. It's when you have too many chromosomes. And so molar pregnancies can have up to 69 chromosomes. And just as a refresher, normal number of chromosomes is 48. So way too many chromosomes. It's not just a trisomy or a monosomy. It's way too many chromosomes. And so what's happening from a biology standpoint is that the egg gets fertilized by two sperm. So there's one egg and two different sperm that make it into the egg. Two sperm and one egg. And so you end up with way too many chromosomes because the sperm each give a full set of chromosomes to the egg, and the egg already has its own chromosomes. And so you end up with way too many chromosomes. And so molar pregnancies are not viable. You have to get an abortion. There are different types of molar pregnancies. We won't talk about them, but sometimes a fetus does form, but the molar pregnancy will end up killing the fetus even if there is a fetus that develops. So you do need an abortion at some point, and then your risk of cancer after having a molar pregnancy increases as well. And this is very rare, just for the record. This is pretty rare, and you identify molar pregnancies in the first trimester ultrasound. And it shows up just kind of as like a big mass in the uterus. And there are lots of signs of molar pregnancies, like a lot of vaginal bleeding, or if the uterus is growing too quickly for what it should be sized at. You can see the molar pregnancy is much bigger than a normal pregnancy. And so those are all signs of molar pregnancy. There are signs of other issues as well, but those can be signs of a molar pregnancy. And so an ultrasound can be used to diagnose a molar pregnancy. And just for reference, when we say a molar pregnancy is rare, it's about 1 in 1,000 births. So in every 1,000 births, you'd expect to have about 1 molar pregnancy. The other congenital defect or birth defect that we'll talk about are heart defects. So you can have a lot of different types of defects of the heart. One common one is holes. So you can have a hole between the chambers of the heart that lets fluid or blood move between the chambers that they shouldn't be moving between. You can have issues with the valves of the heart as well. So these valves can be leaky, and they can let, again, blood move back through them when they should only be moving the other way, or they should only be moving one way. You can also have defects of the vessels as well. So you can have the vessels going in the wrong direction or to the wrong chambers of the heart. And then the heart can also be what's known as hypoplastic. And this is fancy medical jargon for too small, or that it didn't grow enough. And so the heart can just be too small, and it's not strong enough to have the child survive or the fetus survive. Okay, so heart defects are also pretty rare, and it's also at a rate of about 1 in every 1,000 births as well. And so these kids, there's a big variation in what they need. If it's a hypoplastic heart, they might need something as much as a heart transplant. And if it's a small hole or a small issue with the vessels or valves, they can sometimes do a small surgery to fix it. So the next defect that we'll talk about is neural tube defects, and we talked about this in a previous video, neural tube defects. And so again, just as a reminder, this is when the spinal cord that travels in your back is exposed or bulges out of the bottom of a baby's spine. And so this is the most common one. This is known as spina bifida, but there are other types of neural tube defects. And this can be treated with folate, at least spina bifida can. And this is usually also at a rate of 1 in every 1,000 births. If your clients are a lot of women who don't eat very well or have poor diet, this rate would be higher. So the last one that I'll talk about is cleft lips or cleft palates. So this is another semi-common error in development. So that's these here. And so this is, we're looking at kind of a nose up here, and then the mouth down here. And just for reference, your palate is the roof of your mouth or the top of your mouth. And so when you have, these are examples of cleft lips, but underneath this person's top lip in the roof of their mouth, they may also have a cleft that connects between your nose hole and your mouth hole, basically, and you get kind of one big cavernous space in the mouth. And so this would be an example of a normal nose and mouth, and then this would be kind of a more minor cleft here, and then this would be more major cleft into the nose, and then you can also get a double cleft or a bilateral cleft where it goes into both noses. So these would be examples of clefts. And cleft lips and palates are a little bit more common than the other ones. This is about 1 to 2 cleft lips or palates in every 1,000 births. So it's a little bit more common than the other ones, but this can be fixed with surgery to the face of the baby. So these are just some examples of the issues that you can have in development, in the development of a baby. Everything from developing a non-baby, like in molar pregnancies, all the way down to more minor issues like cleft lips or palates that can be fixed quite easily.